now. Good afternoon. We are here, United Medical ACO. Today is September 25th. My name is Kemal Erkan. I have Lisa Bond from Humana. Lisa is the Humana Senior Manager for Delaware and Maryland states. We are going to go through some updates for the Medicare enrollments for those patients who are either eligible for Medicare or already have Medicare. And then before we start going into that, I do want to give my daily, weekly updates from what's happening from the COVID-19 management standpoint. As I mentioned, we have this meeting on a weekly basis, and we try to keep the agenda pretty specific to one really important topic. And right now I'm sharing my screen, and I'm hoping that everyone can see. Just for those who may not actually remember who we are, United Medical has different services in healthcare. This is from the EMR to the medical billing to the credentialing. All those services are under one. But the main, one of the main difference in today's healthcare landscape that we do differently is accountable care organizations. And my guests today, actually, they are one of our first programs that we started in Delaware, and we have learned a lot from them. And I'm hoping that they are also seeing the results from our side, from our populations. One really important part that I want to point out, the Quadruple Aim, where we are challenging the Triple Aim. So Quadruple Aim includes our physicians, our providers, because anything that's going to be looking for the best outcome, it will not be happening unless we have our providers on board. And we do want to make sure that we understand that we are challenging the Triple Aim from that point. Now, again, just so it may be a little complex diagram here, but it's really not. United Medical in the center of this, we do the population management, and we have our contracts with right now 6 different insurances, and Medicare MSSP was the first, one of the first one, and then Humana, which is a Medicare Advantage group. And we have Highmark and 2 Medicaid programs since 2017 and 18. And what I would like to do is, because I think I talked a little bit more, if Lisa can introduce herself, and we'll go from there.
I'm Lisa Bond. I am the Senior Market Manager for Humana, and my territory includes Delaware and Maryland. And we are thrilled to be your guest this afternoon and want to congratulate you for providing this information to the public. We're coming up on open enrollment for Medicare, and one of the things that we find more and more frequently is that our Medicare population is very confused about what Medicare is, what constitutes eligibility, and so we're going to break it up into bite-sized pieces today, make it a little easier to digest.
Thank you so much for that. And what I will do is, there are 2 updates that I want to give for our followers. One is the weekly update for the United States corona numbers. Right now we are at almost 208,000 total number of deaths, with almost 2 million confirmed cases. And it's about 4,440,000 recovered rate, which actually recovered number, which puts our recovered ratio to 96%. Now this number looks good. It's all okay from that point. Looks good in a way that I was just referring to the recovered ratio. So one of the really important part is, if I don't mention this, if I'm not going to be doing my job, tests in 1 million for different states is really important. And right now, United States, we are at 307,000 in 1 million. And I want, outside of Delaware, any other state, I want them to actually look at this chart and see where they are. And when I actually sort this table by tests in 1 million. As you can see, Rhode Island, they are at 676,000 with the population of 1,160,000. That means almost 65% of their population is already tested. That's amazing, and we congratulate them. However, we cannot say the same thing for Delaware yet. So unfortunately, our ranking is going down from the center here, from the average. So Delaware right now is at 284,000 total tests. That puts us almost like 26% of the total population. And I do believe that we can do more testing, and this is really important for everyone to kind of understand why we are actually sharing this. Now, from the Delaware specific numbers, we have the current hospitalization, the new hospitalization, and I'm going to actually bring the Delaware live data so that we can actually look at that together. Over here we have total hospitalization for daily. So right now 57 people as of September 23rd, and then new hospitalization as of September 22nd, it's at 20. That's kind of like, it seems like it's averaging around 20 in the last 4 days. But these blue bars, each of them are 14-day average, except that this is the new admission, so they're actually unique numbers for each day. The percentage of people who tested positive, the 14-day average is around 6.6%. That number is slightly going down. It's like we were at 8.3% as of September 10th, but I think that's a good thing that it's going down. If we were to have double of these tests, and if these percentages were staying the same, then we would be more comfortable making any conclusion with these. But I think that's where that inaccuracy is coming from. It's not necessarily the number is inaccurate, but it's not enough to just say that we are doing enough number of tests. The new positive cases, the blue bar again is the 14-day average, so it's about 103. In case you haven't seen the older sessions, so the orange bar is what's reported on that day, so we really don't worry about that as much. The main thing is on the blue bars is a 14-day average, so that's a stable number to kind of rely on. So that's where we are from that point. Now, Lisa, again, thank you for joining us. And many people have this maybe confusion between Medicare and Medicaid managed cares, because we use managed care on.
So the broadcast was paused.
So what we'll do is we'll use the Zoom video if the Facebook is giving the problem.
Okay.
Yeah.
It looks like it's back right now.
It's back. Okay. So apparently there are some disconnect on some connection issues, but we don't have the problem on the Zoom. The video is being recorded. If the live version of this on Facebook is not so great, then it's going to be posted after we complete the event. So as much as you can follow us live, it would be fine, but otherwise it will be posted right after we are done. So the confusion that I was talking about Medicare and Medicaid and these programs. Now on the Medicare side, we call them Medicare Advantage programs. On the Medicaid side, we call them managed care programs. So now the reason we wanted to have Humana with us today is so that they can kind of educate us from the Medicare standpoint. And Lisa was extremely nice to us, so then she wanted to share what that is for us, and especially for our elderlies who are who needs more information. So our goal is to provide you as much information as possible.
Very good. Thank you. Well, you know, it is that time of year. A lot of our senior citizens' mailboxes are filling up quickly with advertisements and flyers, and it's Medicare season. So it brings about a lot of anxiety because people are very confused sometimes about what is Medicare, what is the best option for me, will I be able to afford the option that I choose? So today I want to just educate your viewers on what Medicare is specifically, what is involved in eligibility, and how to determine which course of coverage would be most suitable for them. We'll look at the next slide.
Oops, sorry, 1 second. Yes.
Basically, Medicare is a government program, and Medicare eligibility is determined two different ways. Either by aging in, those members who are turning 65, or if you are completely disabled for 24 months, then you are eligible for Medicare due to disability. Now, your Medicare Part A is your hospitalization, and that covers 80% of your hospital charges and skilled nursing care, that sort of thing. And Medicare Part B, that's your doctor's office services and outpatient services, and Medicare covers 80% of those as well. So if all you had was the red, white, and blue Medicare card with Part A and Part B, you would be covered for 80% of hospitalization and doctor's office services. So the question comes up, how do I cover the 20% that's left over? And what do I do about prescription drug coverage? That's what is considered both Medicare Part C and Part D. Medicare Part D is prescription drug coverage, and it is coverage that is controlled by the Centers of Medicare and Medicaid Services, but it is administered by private insurance companies. So it gives you the prescription drug coverage. We talked about eligibility. Another way to become eligible for Medicare that I didn't mention, as well as aging in and total disability, is through being diagnosed with end-stage renal disease or kidney failure. So for those that are on dialysis because of end-stage renal disease, they are eligible for Medicare as well. What do the Medicare parts cover? We mentioned Part A covers those hospital services, and Part B covers doctor's office and outpatient services. Medicare Part C, or Medicare Advantage plans, that's where a company actually administers the 80% benefit for Medicare. And on the 20% that's left over, we negotiate with participating doctors and hospitals a set copay or co-insurance for the member. The nice thing about Part C plans, they do include prescription drug coverage at no additional cost, and often some extras like dental and vision that are not covered by original Medicare. Another option, someone can choose original Medicare and a Medicare supplement plan. And the supplement plan pays after original Medicare pays. Now, one important thing to remember about a supplement, it does not include prescription drug coverage like the Advantage plan does. So you would have to carry that separately, and that's going to mean that you will incur an additional premium for that.
So, Lisa, just so that I can kind of highlight some of these. Now, Medicare patient, let's say, actually my mom, she may be upset with me now by saying this, but she's 69, she's almost 70. So she would have been eligible for Medicare after 65 years old. At that point, so she can just choose this, which would be the original Medicare, we are saying, right? But in that case, patient would be responsible for that 20% at any given time because they don't have any coverage for that. So, and we don't want anyone to be in that situation, of course. So then most likely they will go with original Medicare and Medicare supplement as a secondary, we call them. So then these two are together as they are the traditional Medicare. But now, on the option 3 is the Medicare Advantage, where Humana and other Medicare Advantage programs comes in. So how is that different? If you already said, I'm going to ask you some questions, maybe in repeat, but why would we choose this group versus this one? What would be the main advantage of doing that?
When you choose a Medicare Advantage plan, the Advantage plan actually assumes the 80% liability for Medicare. So Medicare is paying the Advantage plan to administer that 80% benefit. On the 20% that's left over, the plan negotiates with participating doctors, hospitals, and facilities to accept set copays for the services that the patient receives. A Medicare Advantage plan is going to be far more cost effective on the front end. Sometimes we have plans that are zero premium on the front end, and the patient just pays the copayments for the services they receive on the back end. Whereas with a Medicare supplement plan, they're going to pay a premium per month for the plan, whether they use it or not. And then their copayments on the back end are going to be limited.
I see. So it makes it almost like less complicated from the managing different payments and different coverages standpoint. So that's great. All right. So how do we enroll for Medicare?
When someone becomes Medicare eligible, either through age or disability, they have what we call an initial election period, an initial coverage election period. And this period starts 3 months before their birth month, the month of their birth month, and 3 months after their birth month. And they have this 7-month period where they can enroll in a plan. Now, for those that are past that initial coverage period, the open enrollment period every year starts October the 15th and goes through December the 7th. So members have the ability to make applications for one or as many plans as they want from October 15th through December the 7th. The last application that they sign will be the one that will become effective on January 1st of the following year.
So I guess like one of the reasons that we are doing this meeting today is the important dates, and October 15th to December 7th. Why are those dates important for us?
Those dates are important because if a member wants to switch plans, or if they want to investigate options, or even look into the current plan that they have, Medicare Advantage plans can change from year to year. So if you look into the specifics of your plan for 2021 and you find something that maybe the network has changed, or maybe the availability of your prescription medication has changed, or maybe your needs have changed, October the 15th through December the 7th is the time to make the change to get the plan that would be most effective for you starting January 1st of 2021. Now, there are situations outside of that annual election period that would allow someone to make changes. That's what we call special enrollment periods. So if you've got somebody that's on a Medicare Advantage plan, which of course we know you have to live in a specific service area for an enrollment plan, for a Medicare Advantage plan. If they move outside of that enrollment area, then they have a special election so that they can choose a plan in their new area for someone that moves. If you have someone that becomes eligible for Medicaid, they're eligible for different plans that they may not have been eligible for before. So they will have a special election period as well.
So for patients to make these decisions, I guess if we can highlight how they can make the decision and based on what?
Absolutely. Things that you need to consider when you're looking at any type of plan is how much does the plan cost? Is it something that's affordable? Does it fit within your budget? What are the benefits? Oftentimes we'll have people that will call and say, does your plan include dental and vision? Because we know that Original Medicare does not offer dental and vision. Does your plan provide transportation? Does your plan offer me Silver Sneakers gym membership? So all of these extras are important. And what Humana's done is we've tried to incorporate extras that can help our members live a healthier lifestyle, such as the Silver Sneakers and Go 365, which is a program that incentivizes our members for healthy living activities, like their annual wellness visit. It's very important to contact your primary care doctor and get that scheduled every year. We want to make sure that that plan is convenient for you. Are the providers that you use in network, and are they conveniently located? Does it fit your needs? And also the healthcare facilities that you prefer. Are they in network as well?
Absolutely. Now, in terms of what patient may need when they're going into the new enrollment, if we can go over those briefly.
Yes, absolutely. You always want to consider your healthcare history. You want to have someone look up your prescription drugs to be sure that they're covered and to find out what tier those prescription drugs are covered under, so you know what your copay responsibility is going to be. And you also want to determine if you're going to need more coverage than you would get under traditional Medicare Part A and Part B, such as the dental and the vision that we mentioned earlier. When you are choosing Medicare Advantage, there are some criteria in order to get an Advantage plan. You do have to have both Medicare Part A and Part B. Sometimes you have to pay an additional monthly premium, but there are some very rich Medicare Advantage plans in our area that are a zero premium. You do have to remain a Medicare member, and as long as you keep paying that Part B Medicare premium, you can have the Medicare Part B and a Medicare Advantage plan. And along with the Advantage plan, you may have an opportunity to purchase optional supplemental dental and vision to beef up the dental and vision that's included as a part of your plan.
Under what situations patient may have only Part A versus Part B? Because you mentioned that they need to have Part A and B together. Like, what situations that we would only have Part A?
Well, oftentimes we're seeing that our seniors are working well beyond the age of 65. So, and they have employer coverage. So their Medicare Part A is automatic at age 65 based on their work history and the number of quarters that they've put in and paid into the system. But Part B can be deferred. So if you're working and your employer is offering employer coverage, you really wouldn't want to pay that $144 Part B Medicare premium in addition, because your employer coverage is covering those Part B services.
I see.
So in that instance, you would have the A and maybe defer the B.
So we have these different type of Medicare Advantage companies, I guess, organizations. I see that we have 4 of them here. If you can just educate us on those.
Sure. These are all types of Medicare Advantage plans. They are all network driven. HMOs or health maintenance organizations, these are plans that are network specific. So with an HMO, you do have to utilize doctors that are in the network in order to receive services. There are some exceptions, such as emergency care. Some HMO plans require referrals. Others don't. Ours do not. That's a big benefit. PPO plans, preferred provider organizations, these plans give you the ability to go in or out of network for your care. If you decide to go out of network for your care, often you're going to be responsible for a deductible and a higher co-insurance, but it gives you a little more freedom as far as who you use. Private fee-for-service plans, these plans, you can use a provider that is contracted with Medicare, but the provider has to agree to accept the terms and conditions of the plan. And then special needs plans, these plans, they service certain subpopulations, such as populations that are beneath the poverty level, that are considered Medicaid eligible because of dual eligibility, or some areas have what we call chronic condition special needs plans. And those special needs plans are specific to people that have certain chronic conditions. Medicare supplement insurance plans, you may hear those referred to as Medigap plans. The thing to remember about that is Medicare pays first, the supplement pays second. The special needs plans, again, those are specific to certain subpopulations, such as those who receive full Medicaid or those who have certain chronic conditions.
Right. So why would someone go with Medicare Advantage? Again, there are some reasons how to make that decisions, but what are the extra benefits in these cases?
Oh, sure. We have Medicare Advantage plan members who absolutely love the Medicare Advantage plans because of the extras. Not only do they incorporate the Part A, Part B, and Part D prescription drug benefit all in one, they often include extras such as the fitness programs. Silver Sneakers is the fitness program that's included on all of our Humana plans. And our plans also include vision and dental coverage. Humana has our own mail order pharmacy, Humana Mail Order Pharmacy. Extremely convenient. We've received J.D. Power awards for the last couple of years for our customer service and accuracy. And also, our members do have access to a 24-hour nurse advice line as well.
So again, I think from those four, the mail delivery with the pharmacy is really important, but also I see the nurse advice hotline, which is kind of reminding me of the care coordination, care management, which where we actually work together a lot. So those are really helping the overall health, the health of the patient. So like someone not being from Humana, I just want to make sure that I do mention that, because especially at a certain age, getting everything done properly and getting enough support, I think that's really important. And having these two, especially these two, I think that makes a big difference for the patients, hopefully.
Having someone that is knowledgeable, that can help guide you through this process, is really invaluable. And that's one of the things that Humana offers to the community. We have local agents that live right here in Delaware as well as in Maryland that are available to answer questions. They're available to assist with enrollments. They're available to explain not only the plan specifics, but just the specifics of Medicare. It's really difficult to make a good informed decision for yourself about Medicare coverages when you're really unsure about what Medicare is itself. So that's something that our agents are very, very familiar with, and they're more than happy to help anyone in the community that reaches out.
That's great. And if I think we are at the end of your part, Lisa. So anything that you would like to add? And I have a couple other questions once you say what you need to say.
Sure. I just wanted to thank you again for the opportunity to just kind of break this down in simple terms for your Facebook Live audience. I've been with Humana for 10 years. I was a field agent for 10 years, and I sat daily across the kitchen table from seniors who were apprehensive because they didn't understand the process. They went into it thinking that they wouldn't really be able to afford the option that they needed to take care of themselves properly. So they were always very pleasantly surprised and grateful when they found out that options were available that could meet their needs. I do highly encourage our seniors to involve their adult children in the process. Let them help you make the right decision, not only for yourself, but so that they are aware of what your benefits are in case something happens and they need to take over any aspect of your care.
That's excellent, and I really do appreciate the time. Lisa, I have a couple questions, perhaps, or maybe a comment. So I think the part that really needs to be understood, well, like one disclosure that I have, we are United Medical ACO, so we have no financial gain from this call or any patients picking this insurance or that insurance. So it doesn't make any changes from our side. So I have no really biased opinion from that point. I always weigh these things based on how I would like my family to be treated and what type of support they should be having. So if there's a, let's say, if someone is going to get bariatric surgery, and if, let's say, if my sister, she's in perfect shape, but if she is 47 BMI, I would ask her to go through the program. So it's not about like, if my mom has diabetes, I would understand what that patient needs from my mom's standpoint. So how we can actually support the patients and get the proper help. And in some cases, when we have only traditional Medicare, what we see is the support piece is missing, where we have this great partnership with you and other plans as well, where we are able to actually provide that support more to the patient at every given, at every level. So I think that's really important. So if my parents were on the Medicare plan right now, so because they live in Turkey, so they're not on Medicare, but if they were here and they have Medicare, I would ask them to pick one of the Medicare Advantage plans. Doesn't matter which one it is. Most likely, there are a couple. I mean, if they are qualified to be one, they are usually good. But if they are going to be more support from the traditional Medicare, and hopefully I don't get in trouble for saying this. But Medicare also wants these pieces to be provided for them as well. So I think this is really good for patients. Now, one of the other things that I want to say is that, especially now after the pandemic, so we have done, we have seen almost 93,000 patients in Delaware, just Delaware only, from the ACO standpoint. And most of these patients done through telemedicine, telehealth. And if I don't mention this, again, I wouldn't be doing my job, but understanding why telemedicine is important and how actually it's protecting our patients. And main reason that we are doing it is it's not 100% all done through telemedicine, but we want to make sure that patients who can be seen through telemedicine, they don't have to leave their home, because right now it's the flu season, and the last thing that we want is our patients to leave their home for something that can be done through telemedicine. And now that brings me to my next point, getting the patient portal activated to have a seamless, smooth connection to the providers. You have to, for our patients, you have to have Healthy Life application, which is our patient portal. We may be calling it IQ Health. On our YouTube channels and social media sites, you'll see more training videos, what you can do. And these things we were able to do those before, but now we added the telemedicine video through the IQ Health from patient portal that makes it extremely smooth and efficient from that point. Now, I want to add one other thing, and Lisa, you tell me how you feel about these events, and I may already know because we are doing this together, but I think when we have the telemedicine, telehealth, and other things, and patients are not leaving their home or living in a limited conditions, I felt like it's really important for us to be able to put more resources out there and more source of knowledge, education on the conditions. And one of whom is we are doing with our bariatric program. And on the Medicare side, this may not be a big issue, especially with patients over 65. However, we do have our diabetes program. We go live twice a month. We have done, I believe, 5 sessions so far. I do this Friday weekly call, and today we have Humana, but prior weeks we have a cardiologist, we have a primary care physician who's actually focusing on certain areas of the issues that patients may be having. But main reason we are doing it, so this is a good, easily accessible source of information to help you to manage your conditions. Hopefully everyone can take advantage of these. Next week, actually, we have on Wednesday, September 30th, we have a care coordination during the bariatric process with Dr. Erkan from CRIAS. That's going to be at 3 p.m. And then we'll be back on October 2nd for our Friday call. And at that time, I'm going to have Dr. Jan Lee, who's the CEO of Delaware Health Information Network. And then we can actually explain our Delawareans how DIN works and how patients actually benefit from it, and other organizations can actually take advantage of the setup that they have. And this is all, I mean, again, all the reason that we are doing this is because we want more information out there. We want to be more accessible. We want you to be able to access to us. And hopefully this is helping everyone. Now, I don't know if you have any questions that we didn't answer. I'm going to look at Tanner, who's here with me. So it seems like we covered everything. Lisa, do you have any last any comments for closing?
We at Humana are just as committed as you are to protecting our senior population. And I believe that providing information in a safe, no contact environment, such as these streamings, is a great, great resource to the community. And I just wanted to say hats off to you for providing this.
Thank you. Thank you. Well, again, this was a lot of fun, and I enjoyed these videos. I feel like we are able to accomplish a lot with these, and thank you for being with us. And we'll be making this offline available on our Facebook and YouTube channels. You can, when you are bored and you have nothing to do over the weekend, you can watch them. And please let us know if there's anything else we can do for you. And Lisa, thank you again for being part of this, and we'll see you soon. Thank you.
Thank you. My pleasure. Bye-bye.